Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale-Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I perform a lot of breast surgery, and with some of those surgeries, whether it be a breast lift, a breast a reduction, a breast augmentation with lift, there are scars. And common questions that I have from patients, either from themselves or from their friends, and they're worried about things happening, is, what if my scars become raised or reddened, become itchy? What does that mean, and what can be done? Well, to understand what the different terms are, when a scar heals beautifully, that's fantastic. In a very small percentage, and it tends to be more ethnically linked. I think it's a little bit higher in African Americans, Latino, Orientals. There are things that can form called hypertrophic scars, and those are scars that are slightly raised and can become red, and oftentimes with those symptoms become itchy. And there is, right away there's a treatment we can do. Those symptoms and signs don't start right away. They usually happen between 1 and 3 months. And the initial treatment would be in the office. I would inject some very dilute steroid treatment into those areas. It's steroid injections, and that would treat all of those symptoms. It takes care of the raised area, it takes care of the itching, and it helps the redness go away. And that's one of the reasons why we like not to have you wear an underwire bra, because an underwire bra after surgery will cause tension and irritate those scars, which can cause these hypertrophic symptoms and signs. The other thing that we do is oftentimes I will have you put some scar cream. There are different kind of scar creams. We sell one in the office, which is fantastic. And I'll also have you put some silicone gel sheeting on the incisions, and that is placed at night. Some people wear them 24 hours a day, and it's a non-brainer. I mean, it's a no-brainer. You just put the little gel sheets on the scars, and you wear them beneath your bra, and that has been shown to flatten out the scars and take care of the redness. In a very few population, very few percentage of my patients, I will use some laser on these areas, and that is actually an IPL or BBL, and what that does is it takes away the redness and helps the scars flatten out. So there are many, many things that we can do. In a very, very small percentage of patients, I will at a year go back and take out those scars, and almost always they'll heal perfectly. So, don't be alarmed if you hear about this happening in somebody, or if it's happening to you. There is a treatment plan with this. It is not permanent. I say, none of my patients have permanently enlarged itchy scars. The reason being is it looks bad, it feels bad, and it makes me look and feel bad. So, you're my calling card as a patient. I want you to look and feel fantastic. So if these things happen, they happen infrequently. There's a scale treatment plan that we come up with, and we'll deal with it. So don't be afraid. And if this were to happen to you, we would get it done. Okay, so the best way to find out if you're having these symptoms from another surgeon, talk to that surgeon. And if you're thinking about having these surgeries come in, we'll talk about the possible side effects from these incisions, how I would deal with them, and understand that there is a plan and that you won't be blown off as my patient. So come in for consultation and we'll talk about it. Thank you.